welcome to our first virtual insurance and reimbursement conference. And props to all of you who made it and who can finally hear, which apparently was a thing on the last session. So just so you know, on behalf of NHF, I welcome to the federal update. My name is Marla Feinstein. I'm the Senior Healthcare and Policy Analyst with NHF. And before we dive into the session, I want everyone to know a huge shout out and thank you to our sponsors, CSL, Genentech, Grifols, the Hemophilia Alliance, Novo Nordisk, Pfizer, Sanofi, Genzyme, and Takeda. But before I introduce Johanna officially, I want to take a moment and thank all of you guys for attending. This is my favorite conference of the year. I know a lot of NHF staff feel that this is also their favorite conference of the year. So I'm thrilled that we have this many people. And let me just say, we have about 190 applicants, which excludes speaker, staff, and industry. And you guys are amazing. You guys are on the front lines and you're doing it all the time. And we at NHF and all very much appreciate the work you do. But by having it virtual, we were allowed to expand it to nurses so they were not overlooked. And some of the other HTC staff, because we know each HTC operates a little bit differently, and we just wanted to give them an opportunity to join while we have the capacity in the virtual world to extend that to them. So let's welcome a virtual welcome to all of our first-time attendees, because I'm not even sure how many there are, but it is a lot of first-time attendees. But we appreciate you guys all being here and taking the time. Okay, Johanna, it's all you. Good luck.
Awesome. Thanks so much, Marla. And I will echo what Marla said. It's funny, I'm pretty partial to Washington Days, but this is up there among my favorite NHF conferences as well. It's disappointing, of course, to not see everybody in person this year, but glad that we can get together on a platform. Very, very 2020. Hopefully my Wi-Fi will be strong enough that my audio persists and the mail doesn't come and my dog goes crazy. But you never know what's going to happen. So we will hang together. As for those of you who don't know me, my name is Johanna Gray. I am one of NHF's federal policy advisors. I work in a very busy Washington, D.C. It's dreary a lot of the time, but it is today as well. So today I will present an overview of NHF's federal policy agenda and then dig into some details, a number of key issues that we have been working on this year. Many of you have participated in Washington Days or have attended this conference in the past, so I'm going to stay pretty high level on our key issues. I want to leave time for Q&A and discussion at the end. Then spend a little bit of time talking about future, what the future might hold for the issues we care about. And then I'm really excited about some new ways for you to advocate from home. So this slide has an overview of NHF's federal policy agenda overall. I've presented a version of this over the years. This conference is obviously focused on insurance and reimbursement, access to care issues, but I always like to start presentations for NHF with this slide because we do have a pretty robust federal policy agenda. We try to cover lots of ground with our small DC team in these 4 areas. So research, surveillance, and outreach, those are the federal programs at the agencies listed here that are focusing on improving care for people with bleeding disorders. Support for HTCs comes from their grants, as well as the 340B drug discount program. Blood and product safety and drug approvals have listed the FDA and an advisory committee here. We know this is an area that has long been a part of NHF's agenda and unfortunately has been a busy part of our work over the last few years, which I will update you on as well. And then, of course, access to care. So public and private insurance policy been very active over the last 10 years or so. So to start with COVID, could you start a conference and a presentation in 2020 without talking about COVID? I think not. Congress was very active in responding to the pandemic early on, passed 4 big packages in the spring and early summer. And since then, there's been a lot of talk, and there are competing bills from House Democrats versus Senate Republicans versus Senate Democrats. The White House is involved in all of this negotiation. So since then, there's been a lot of talk, but little meaningful action. There is continued negotiation. Every day they continue to try to reach consensus on the next bill. They were hoping to pass it. First, it was before Congress's August recess. Then it was before the end of September. Now it's before the election. Of course, that's just a couple weeks away. I think what's tough about big congressional packages is they don't exist. They seem very far away until all of a sudden they exist. It can be lots of hurry up and wait. So we're continuing to closely monitor what Congress is doing. I think it's likely that if there's another COVID bill, it will happen after the election. I'll talk a little more about that in a few minutes. For the Trump administration's part, the administration declared a public health emergency in the middle of March, which goes for 90 days at a time and was just extended to mid-January 2021. That's important because there were a lot of policy changes that are tied to the period of the public health emergency. So all of the expansions of telehealth, for example, that are allowed in Medicare and Medicaid now, many of them are time limited for the public health emergency, which goes at least until mid-January. I think whether or not it's extended again will be determined by kind of the state of play at that point, and we can update you as we get closer to that deadline. NHF has been active in responding to a number of issues related to COVID. We have one blog post that we've updated several times with links to letters and statements that we've done. We will, I think, to anticipate one question, we will circulate a recording of my presentation, and you can have access to the slides. So you'll be able to, I have links in several places, so you'll be able to access it. But if you're curious about where we have been with respect to COVID and Congress and the administration, I'd encourage you to go to this blog post here. Another issue that we tackle each year relates to appropriations, which is the word for funding for federal programs. Each year, Congress has to pass a law by October 1st. That's the start of the next fiscal year. And Congress has to basically decide what funding levels will be for all federal programs. This is a key part of our Washington days every year. Something that as your kind of team in DC, we tackle throughout the year. The picture on the slide has the bullets from this year's fact sheet from Washington Days about more specifically what we have asked Congress to do. We've asked Congress to maintain our funding for these three programs at HRSA, at DC, and at NIH. Congress was not able to figure out its complete its regular process before the start of the fiscal year. So they enacted what's called a continuing resolution, or CR, basically extending funding from last year until December 11th, 2020. So that is for all federal programs, including the ones that I just mentioned. It's at HRSA, DC, and NIH. This comes up every year, so I try to mention it whenever relevant. Because there is a resolution that only goes for part of the year, HTC grants could also be partially funded because full year funding hasn't been approved yet. HTCs often have questions when they get a notice and it's not, the amount isn't what they're expecting, and so I just wanted to mention that. So then I guess the question is, what happens on December 12th? Congressional leaders say that they are working to negotiate bills so that they could set funding levels for programs for the rest of the year. There's potential for another short-term continuing resolution. I think depending on how things go in the election, there could be a desire to do another CR that goes just until the start of the new Congress, say that could go till February. The new Congress will be sworn in at the end of January. There could be an extension of the continuing resolution for the full fiscal year. They could say, we're not going to be able to reach agreement on funding levels for individual programs. Let's just extend the CR buy us time, and then we'll just kind of take a wash on this year and then tackle the fiscal year 2022 starting in the spring. I hate to say it, but I think that there is a chance that there could be a government shutdown. And, the middle of December in the midst of the pandemic seems about the worst time for the government to shut down. And I think policymakers are going to do their best to avoid that. But I think that always remains an option. And so I always want to mention that as well. Hopefully it won't come to that. Oh, some of my pictures didn't come through. That's a bummer. So the other issue that we tackled in Washington Days, it was the Hemophilia SNF Access Act. This is legislation that we really led the way on. It was introduced this year to improve access to skilled nursing facilities for Medicare beneficiaries with bleeding disorders. This is something we've talked about a lot over the last couple of years, and I really want to credit this group as being some of the most vocal advocates to kind of keep us engaged and keep us working on this, because I think you folks are often the ones really dealing with this day to day, trying to help your patients access SNFs. So we were really, really excited to have bipartisan legislation introduced in both the House and Senate. If the picture had come through, you would see little screenshots of the two bills. We have added co-sponsors to both bills this year, thanks to all of you who have engaged in advocacy on this. We are still hopeful that there could be a broader Medicare bill at the end of the year and that this provision could be added. We're working with our champions on that. If that doesn't happen, we will have to reintroduce the bill in the new Congress next year. And the more co-sponsors we have, the kind of easier that goes as well. And so stay tuned. In a couple slides, I'll show you how you can advocate for the bill from home using this new system that we're really jazzed about. So when it comes to blood and product safety and availability, as I mentioned, this has long been a part of NHF's policy agenda. And as a result of the numerous product recalls that we experienced back in 2019, NHF and HFA worked together to put on a safety summit, which was held in January 2020. The link here, and so that you guys will be able to access when we share the slides, has a link to the executive summary, and then the screenshots. The point of the safety summit was to bring together basically stakeholders from across the whole community. So there were pharma partners, there were federal partners, there were HTC treaters, specialty pharmacies, chapters, international bleeding disorders groups, a kind of handful of individual patient advocates, folks from NHF and HFA. I'm sure I've missed someone. But the goal was to bring together everyone and talk about our shared responsibilities, our shared roles when it comes to ensuring product safety, availability, and kind of we talked a lot about communication strategy for when there are issues. And so the executive summary includes a slide like you can see here that has the kind of consensus rights, responsibilities, recommendations for each type of stakeholder. So I've pulled out just the ones especially relevant to out here, but would encourage you to look at the executive summary. We are working on a report, a kind of more formal report summarizing the event that we will hopefully be able to distribute to everyone soon. And of course, so that was in January. And what is interesting, remarkable, maybe not, is how many kind of issues have popped up since then. So I wanted to just highlight a couple of them. The first is Congress passed a law back in 2019 calling for HHS, the Department of Health and Human Services, to put out a report on ensuring an adequate national blood supply. It's a provision from the law at the top of the slide. And we responded in coalition with a number of other patient advocacy groups who care about blood and plasma safety with recommendations, A, that their policy should not just be about ensuring adequate national blood supply, but blood and plasma, and the need for decisions to be made based on science, the need for end users of blood and blood products to be kind of central to the policy making process. I'm happy to share that comment letter with anybody who's interested just give me a holler if you are. Then COVID happened, and so the Senate Health Committee put out a request on ideas for preparing for the next pandemic. And what's interesting is the Senate Health paper basically assumed that the next pandemic would also be respiratory. And so we sent similar comments to help, talking about how, the next pandemic, knock on wood, could be bloodborne. And so about ensuring the safety of the blood supply should be kind of front and center for Congress as well. Again, happy to share that letter. Then, of course, comes COVID. And, specifically with COVID, I think there were initial questions about, could COVID be transmitted via plasma-based products? And we can share a lot more information with folks if you're interested in the details. I just wanted to pull a couple things. So WFH put out treatment recommendations, and the first quote comes from there, that viral inactivation and elimination procedures employed are sufficient to destroy viruses like COVID. Then it was, well, is there any risk of COVID being transmitted via blood? Here's a statement from AABB, which is the American Association of Blood Banks, who worked with the FDA and CDC, also analyzed data that there was not data or precedent suggesting COVID being transmitted by blood. We also did a lot of advocacy around concerns around supply of plasma. So we advocated for collection facilities to be prioritized distribution of PPE, for example, because we heard early on, maybe in April, there was a concern that all of the new requirements around wearing masks were important to keeping the people who work at plasma collection facilities safe, as well as donors. It wasn't enough, and so folks were concerned that plasma donation centers would have to close because they just couldn't meet these rules. And we obviously want to keep a robust supply of plasma to ensure that all products that folks in our community and the patient community take, are safe, of course, but also this is where availability comes in. So those, I think, our advocacy around plasma safety, those are all on the page, which we will share. Okay, so staying in the blood and product safety world, of course, another that we had this summer was the recall of Stimate. Have here, or pictures here of the medical advisories that NHF we did too, because first it was only a pharmacy level recall and then it was a patient level recall. I know for the conference had questions about what, any recommendations for centers, about what to do for patients who are on Stimate, because we understand the folks at CSL that we are unlikely to have Stimate back on the market before, I think it was 2020. So I just want you to know that NHF, HFA, and the Hemophilia Alliance are all kind of working together on this, both to better understand from CSL and from Fairing what happened, what the timeline is, how it will be resolved, and alternatives for patients in the meantime. MASAC is involved in this as well. I'll say that it has been frustrating to get answers to our questions about kind of what has happened. I think CSL, frankly, is in a tough spot as the kind of U.S. partner of Fairing who makes the product, and I think the issue is really on the Fairing side. So we sometimes have a bit of a game of telephone. I just want you to know that we're working on this, and we'll be in touch as we have more information, especially about alternatives for patients in the meantime. The other thing I will say is I know there were also questions about access to Amokar, and wanted to say that I know that I understand that both the brand name and Amokar access folks think will be improved, and the Hemophilia Alliance sending out information about new strategies to access Amokar. Okay, so to turn to our next issue, President Trump released several healthcare executive orders in recent weeks, and I think what's important to know about executive orders, or EOs, is that they set out broad policy goals and then call for agencies to implement them, but they all require further rulemaking. They set out big picture things, like it is the policy of the United States of America that everybody should have apple pie on Tuesdays. And then it calls for agencies to put out rules to say, well, how are you going to make it so everybody eats apple pie on Tuesdays? And so there are opportunities for us to comment. And this slide has just the titles of of them. I'm happy to go into details on any of these if folks when we do Q&A minutes. But I think what's most important to know is that these are policies that still have to be implemented. A number of these, the regulations or the rules that agencies will put out haven't been released yet. And so even when the rules have been released, additional steps folks would need to take. So for example, in the top corner, the executive order on increasing drug implementation is an executive order that calls for a rule about how some drugs could be imported from Canada. Okay, so then the rule came out that said, here's how we're implementing this policy to allow some drugs to be imported from Canada, but states have to choose to apply to import the drugs. I just saw this morning that the state of Florida put out a $30 million RFP for someone to help them implement this new importation policy, and nobody applied because it's complicated. It's not clear that manufacturers are going to go for it. The Canadian Health Service is really wild about this because they're worried about drugs being diverted from Canada to come to the U.S. So even something where the initial steps have been taken to implement it, many more steps need to happen. So I think my main message for the executive orders is that we are monitoring all of this really closely, and we'll let you know as any of these, if and when any policies become real and become something that could affect the community. I think for now, they're all kind of too big picture to really be concerned about. We're concerned about them, but you shouldn't be yet. Okay, so turning to last kind of policy issue, the Affordable Care lawsuit is something that lots of folks ask questions about as well. And this is, so I'm going to spend a few minutes on kind of what's at stake with the lawsuit, did we get or what might happen when it comes to that. And I hope that this, spoiler, 5 minutes from now, I hope that this will be reassuring to you. So to understand the current lawsuit, you kind of go back in time a little bit. The yellow dot, the first thing that happened in the timeline was in 2010 that the ACA was signed into law and the first lawsuits were filed. The next dot, the Supreme Court found that individual mandate is legal, but it's only legal as a tax. So the question before the Supreme Court was whether Congress could pass a law saying you have to buy health insurance. And what the Supreme Court found was that, well, they can't make you buy something, but they can implement a tax on you if you don't. So the individual mandate is legal because it assessed a penalty when you pay your taxes. Flipping ahead to the kind of teal dot, in 2017, Congress removed the individual mandate penalty in the tax reform law. So where it used to say if you didn't have health insurance, you would have to pay a, say, $600 penalty. Now it still says you have to have health insurance, but the penalty you would pay is $0. So then flash forward to 2018, 20 state attorneys general filed a lawsuit challenging the constitutionality of the entire law, basically saying, well, the Supreme Court said the individual mandate's only okay if it's a tax. The tax penalty went away. Therefore, basically, the individual mandate has gone away. And the individual mandate is so integral to the entirety of the law. If the individual mandate goes away, so too should the entire law. That's what the 20 state attorneys general said when they filed the lawsuit. So what has happened? So at the first stage of the case in Texas, the judge basically agreed with the argument that I just laid out and said that the entire Affordable Care Act is unconstitutional but he issued a stay so that the law stands during the appeals process. So the law is unconstitutional, but nothing will change yet. It then went to the Fifth Circuit Court of Appeals, which said, kind of agreed that the individual mandate is unconstitutional because, again, it's not producing revenue for the federal government. But rather than saying, so the whole law should be thrown out, they referred the case back to the Texas judge to say, okay, if we agree with you the mandate is unconstitutional, you need to rule on which parts of the ACA would also need to be struck down if the individual mandate goes. Rather than going back to the Texas judge and going back and then the Fifth Circuit, people wanted to go directly to the Supreme Court to get kind of a final ruling on this. And so the name of the case changed because it was Democratic attorneys general who filed the appeal to the Supreme Court. So it's now called California v. Texas. An oral argument is scheduled for November 10th, so in just a few weeks. So the real question on everybody's mind is what's going to happen when the Supreme Court hears this case in a couple weeks. And the two main legal questions relate to standing and severability. So the first question is, original people in Texas who filed the lawsuit said that they were harmed because even though there's no penalty anymore, just having an individual mandate on the books harms them because it makes them buy insurance they don't want to buy. And so the first question of the case is that legit? Do those people, have they been harmed? Do they have standing to file the original lawsuit? The second question relates to what's called severability, which is the term for how much of the law relates to the individual mandate or how much can be separated from it. So the blocks in the middle show a range of things that could happen. Kind of on one end of the spectrum, the case could be dismissed due to standing. The Supreme Court could just say, well, no, this doesn't really make sense at the outset, so we're dismissing the case on that reason. I think most people think that's unlikely because they could have just declined to take the case if they didn't think there was standing. People think it's unlikely they would have taken it if they're going to throw it out on those grounds. The next thing is, it's again possible but unlikely that the Supreme Court could say, oh, that's okay, even though there's no penalty, the individual mandate is constitutional, that they would disagree with themselves back from the 2012 decision. Also pretty unlikely. At the other end of the spectrum, the entire Affordable Care Act could be found to be unconstitutional. They could agree with the Texas judge. Yep, the mandate's unconstitutional. Every part of that 2,000-page bill or law, ties back to the individual mandate. Therefore, the whole thing needs to be thrown out. I think most legal scholars think that's also very unlikely for lots of reasons. People are looking at tea leaves about other Supreme Court decisions made by the current justices and how they're likely to view the question of severability pretty wonky pretty quickly. But I think everyone's biggest fear that the whole ACA is thrown out, again, people think is unlikely. So the question is then what happens in the middle? So if the individual mandate is the only thing that's found to be unconstitutional, that wouldn't really change things because the penalty's already gone away. So that's kind of more or less a status quo. I worry a lot is what happens in this box. I don't know if you guys can see that dot. If they say, well, the mandate is unconstitutional and other things that are really closely related to it then are too, because those are the provisions we kind of care most about, the patient protections. And so that's where I think my listening, when I listen to the oral argument, where I'm going to be focusing. But I think the other thing you should remember is that policymakers will respond. They could reinstitute the individual mandate and then the case wouldn't go away. But if the Supreme Court says, well, it's unconstitutional with no penalty, they could just stick the penalty back in. Or there are other policy solutions that Congress could take that are less complicated than passing the whole law again. Regardless of what the Supreme Court does, other policymakers will respond on the federal and state level. So more to come. So most important things to remember are, one, the ACA is still the law. We don't expect a ruling until June 2021, so nothing changes until then at least. And what I worry about is that because of everything in the news around the new Supreme Court Justice, the ACA case, that folks might think the law is already gone. And so to this crowd who does so much work with individual patients and families, I don't want anybody to be distracted from open enrollment, which is kicking off for private insurance and care. Either it's just started or we'll start next week. The other thing I wanted to mention is, advocacy around access to insurance is a core part of NHF's agenda. We did sign on to an amicus brief to the Supreme Court with a number of other patient advocacy groups. We can share that link with folks if you're interested. But, regardless of whatever happens in the Supreme Court next summer, our work will continue. Let's also remember, we still have plenty of access issues despite the ACA. So it's not like even if the Supreme Court were to say, oh, don't worry, the entire law is fine, that ends our work either. Unfortunately, it's pretty much a full-time gig. And because this is about the part of my presentation when I think folks are starting to feel pretty depressed, I had to throw the pig back on from the Adorable Care Act, which was the campaign to get folks to enroll in insurance right when the ACA passed back in 2010. Okay, so all of that is an update for kind of where we are today, and I have just a couple of slides about looking to the future. So the first is, as you may have heard, there is an election in a couple weeks. I always take advantage to show this really cute picture of my niece, but what's funny is this was her last year. Her birthday actually is on election day and she'll be 2, so I'm going to need to get a new picture of her because she does not look like she's a very cute toddler, but not a cute baby anymore. I also wanted to mention that we have this new service for NHF that's called Phone to Action, which has this super cool widget that talks about information about how to register to vote, getting information about candidates. We'll make sure that you guys have access to this link, but it's something that we're really excited about and encourage you to both check it out and to share with your folks. So looking to the future, part 2. So we have the election on November 3rd. Then the question is what comes next? And I will admit, I pick a dramatic picture of Capitol Hill with storm clouds above it, because I do think it will be really interesting to see what policymaking does or does not happen during the lame duck session. I mentioned that they have to take up federal funding. I think they're unlikely to come up with a COVID package in the next week, so that will be on their agenda as well. There's Medicare policies that have to be extended as of December 11th too. If there is a change in the Senate for the new Congress, that also could give motivation, kind of a last effort by people who are currently chairs of committees who may not be next year, to tackle other policy ideas. So it could either be an environment where nothing happens, there's a government shutdown, and this, it looks as dramatic as those clouds do in the picture. But I think there's also potential in a weird way, all the stars align, Congress decides they want to try and get a bunch of things done before the new Congress takes over. We're just going to all have to kind of see how it goes, and it's something that we're actively monitoring, and we'll both respond as your team to happen in DC, and we'll notify you as any changes. I think for the administration side, again, there could be implementation of the existing executive orders, or there could be new executive orders if President Biden wins and the Trump administration wants to, try and implement new policies before his office next year. I think the flip side is if President Trump wins, it could be seen as even more of a mandate to tackle things like high drug prices and importation and all that jazz. So I suspect we will see lots coming out of the administration one way or the other in the rest of the year. I mentioned earlier, that our advocacy for insurance will continue no matter what. And so I'm really excited about this document. The 100 Days Agenda is a blueprint for policy changes that should happen in the first 100 days of the next Congress and the next administration to ensure that health coverage can be adequate, affordable, and accessible. NHF and HFA, along with 30 some other leading patient advocacy groups, work together on this document. And it really sets out lots of policy changes that I think folks on this crowd, if you want to get into the weeds, might be interested in. We have it linked to on NHF's website, and again, we'll share this. We have shared this with both campaigns, so both kind of presidential folks know what our priorities are. It's been shared with congressional leaders. I think as a group, we're intending to really kind of hit the ground running in the new Congress to try and improve access to high quality health insurance, which I thought this crowd would be interested in. And then finally, there are key issues for the community regardless of what happens in the election. You know, coverage and payment for both existing and novel therapies that could be coming down the pipeline soon remains a focus of our team and of policymakers. You know, I've talked a lot about the California v. Texas lawsuit, so I won't say more here, but regardless of what happens, or separate from what happens with the Supreme Court, federal and state policymakers are making lots of decisions about insurance policy, and you're going to hear a lot more about all of this the next week. But it's something that I think we're always keeping our eye out for. And then finally, you know, the effects of COVID-19 on state budgets, on federal budgets, and, you know, economic uncertainty for our patients and families whose insurance might have changed this year if folks have lost their job or their income has changed. All of the issues around helping people access insurance, help people afford their drugs is even more important now. And I'm really hopeful that policymakers will get their act together on a COVID package that could include more policies to try and help American families kind of navigate what's been just such a really tough year. So finally, as promised, we need you to join us in advocacy from home. We have held and will hold virtual Hill Days. You can do a congressional meeting through Zoom. I've done lots of them over the last year. I think, as all of you know, Washington Days will be virtual for 2021, and more details are going to come out soon about that. But in the meantime, we are really just about this new system called Phone to Action. And if you go to this link, you can take action today to send emails or tweets to your members of Congress to ask them to co-sponsor our SNF bill. We're really excited about this way for people to be able to easily send emails and tweets to their congressional offices. We've just kind of gotten set up with Phone to Action in the last few weeks. So this is our first campaign. I think there are going to be plenty more over the next year and beyond. So want to encourage you to see that. If you have questions, give our team a call, and please share that with all of your members. Okay, so now we will turn to questions, and before I do that, I'm going to stop, which is, as I think hopefully everybody here knows by now, my colleague Ellen and Riker and I left our old firm to launch a new lobbying firm in April. What better time to launch a new small business than during COVID? And I just wanted to make sure that everybody has our current addresses and phone numbers so that you can be in touch with us. I think if you email our old ones, you might get a bounce back, but I'm not sure. So just wanted to make sure everybody had these. And with that, I am happy to answer questions.
Joanna, there's a lot of talk about the two main protections in the ACA, pre-X and lifetime caps. Could Congress just pass a new law to help keep those provisions regardless of what happens at the Supreme Court?
Absolutely. Yeah. So Congress, and there is broad support, I think, for both parties for the patient protections, the pre-existing conditions and lifetime caps, and kids on their parents' insurance till age 26, et cetera. So I would expect Congress to take action on those. I think what's tricky, though, is the devil's in the details. And so there have been a number of proposals released over the last couple of years that say, oh, vote for this, and then we'll know pre-X is protected. But it's not just one policy, it's really like 10. So to make sure that whatever comes next, if we got there, there would be a lot of advocacy to make sure that what Congress does is as meaningful. But yes, they certainly could.
And then the next question, if Amy Coney Barrett was, or did I mess up the order? It doesn't matter. If she were appointed, be involved in the decision, would that change things?
Yeah, so the Senate is voting on her nomination this evening, and all indications are that there are enough votes for her to be selected. I guess I'm not sure what the right verb is. So yes, assuming she's sworn in before the oral argument, she would participate in the oral argument and decisions. I think it's tough to say. There's lots of tea leaves being read about where she as an individual may come down on the different questions facing the court. I think it's tough to say, but my expectation, unless something dramatic happens today, is that she will be on the court when decision happens.
This is from Amy Wright. If the ACA is repealed, will that affect Medicaid expansion?
For sure. If the entire law is found unconstitutional, that would affect the Medicaid expansion. It would affect everything in the law. I think if the Supreme Court does something in the middle, I think you could say the Medicaid expansion doesn't really have anything to do with the individual mandate. I don't know that we can really expect them to be health policy wonks, right, to kind of negotiate all these nuances. So we'll have to see what the court does.
And then if there is a new administration, could they just simply withdraw it?
No, and I see that Fernando chimed in. So at this point, it's state attorneys general kind of on both sides who are participating in the lawsuit. I mean, if there's a new administration, President Biden's Department of Justice could decide to defend the law. President Trump's Department of Justice has decided not to defend the law. They have basically agreed with the people who filed the lawsuit that the mandate in the law should go away. So the DOJ part of this could change, but that would just change kind of who's on which side. But, that will all be happening after the oral argument and kind of as the Supreme Court justices are doing their own negotiation. A Biden administration would change the political calculus on how Congress and his administration responds to what the Supreme Court does, but it won't really change what the court does.
Okay, and one more question from Angie Wang. Do executive orders have a shelf life, or do they just stand in perpetuity until it's legislated over or away?
Policy wonky, it's my favorite. And what's funny is sometimes the executive orders come out, but then the implementing regs never happen. We've seen that in this administration and others. So, the executive order that says a policy that there should be drug importation could exist, but if the regs never come, it doesn't really exist. It's one of those like tree drops in a forest. If an executive order comes out and the regs to implement it never does it still exist? And the answer is kind of, but not in a meaningful way. I would expect presidents do lots of executive orders, especially early in their terms. So I would expect if there were a Biden administration that would put out new EOs on lots of the issues that Trump has covered in recent weeks. So we'll see more. Okay. Hi, everybody. Bye. Sorry about all the audio issues. If you have any questions or anything comes up later, I hope you will just shoot me a note. Thanks, guys.